Today I'm speaking with Mselenge Mdegela from Liverpool School of Tropical Medicine in the UK. Hello.
Hello, Melissa. Glad to meet you.
Nice to meet you too. Lovely to speak with you today because you've just about to publish an article with Rural and Remote Health titled Using the Socio-Ecological Model to Appraise Perspectives on Health, Workforce Retention and Intention to Leave in Malawi and Tanzania, a qualitative longitudinal study. Congratulations on your article.
Thank you very much. I'm pleased that the study is finally at a stage of publication.
Absolutely. We're thrilled to be publishing it for you. I wonder if you might first introduce the research team.
Great. So thanks a lot. Our research team comprised of 5 authors. So first is Professor Joseph O'Hare from Warwick Medical School here in the UK. And Professor O'Hare was the principal investigator for a bigger project entitled Enhanced Training and Appropriate Technologies for Mothers and Babies in Africa. And this study was part of that program. So Professor O'Hare coordinated the team, but also was instrumental in the ethics application in the 2 countries for the study. Then Dr. Barbara Madaj, who was the supervisor for the study, was instrumental in conceptualizing the study and supervising the study from start to completion. Then we had 2 colleagues, one from Malawi, Chimwemwe Mvula, and one from Tanzania, Demetria Berman. And these people were instrumental in providing local relevance to the study. And myself, together with research assistants, collected data, and I wrote the manuscripts, conceptualized the study, revised the manuscripts, and here we are today, just about to publish it.
Fantastic. Can you tell us a little bit about how the study came about?
Yes, great. So health workforce is key in providing care, and actually is instrumental in making sure that the universal health coverage is realized. And it is clear that there is chronic shortage of health workforce, and particularly in low resource settings. And part of the problem is that retention of health workforce, how long healthcare workers remain in rural facilities, is really low in these settings. And part of it is because the policies probably guiding human resources for health management are probably not incongruent to expectations of healthcare workers. And so this study was conceptualized to try and find out perspectives on retention by policymakers on one side, and on the other side by healthcare workers, and see whether there is any overlap or there is a divide, and then see if there are any ways of merging the 2.
Fantastic. Yeah, that's a problem around the world, isn't it? And what did you find?
Yes, so our findings were quite interesting. And we based our, looking at our data on the socio-ecological model, as you pointed out initially, which considers that people make a decision based on 5 levels. So one is who they are, individuals. And then first level is the immediate environment, which is the family, which is a microsystem. Then after that is the immediate community, which is the mesosystem. Now this is the social organizations around them, schools, religious organizations. The effect of that to them influences their decision. And then after that is the exosystem, which is like the legal framework, security, police, and the like. And finally, it is the national and international policies governing health and other issues around them. And so our finding was that when you talk to healthcare workers, their main concern goes to the family and the community, and the immediate community. What happens to those and the welfare of those is material to them, would make them decide to remain in a place or to leave. Whereas when you talk to policymakers, actually their main concern, they first go to the governing policies, the national governing policies. And so although these considerations by healthcare workers wouldn't make them leave their facility, but it makes them have that intention to leave. And what that means is it reduces their engagement work, reduces their motivation, their job satisfaction, which reduces their productivity. And at times, yes, they would consider leaving the facility. And so that divide between policymakers looking just at governing policies without much consideration at what happens at the family and community level, and healthcare workers just looking at the community and family level is a divide that I think we think from our side that really needs bridging.
So, what needs to happen next to make sure that there are enough health workers in rural areas?
Good question, Melissa. Yeah, thanks. So what needs to happen is, we think, in most of these low resource settings, the finance is already constrained. So I think any sustainable solutions should not really delve a lot into the already meager financial resources. So we think just reorganizing the existing health workforce, and that would may just mean that in the health, human resource for health department, in the ministries of health of these countries, there should be a dedicated person or section which looks at what is happening at these healthcare workers, like individually. Now we know that is a lot of work, and I think it is nearly impossible to change the policies based on individual circumstances. However, understanding what is going on, among these healthcare workers and making decisions based on that understanding is key, because that wouldn't need any additional financial resources. So, for example, if one would like to move to a remote place because they have a sick relative, father or mother or uncle, then so be it, because that would mean that improve the distribution of the health workforce, because you have the existing health workforce is better reorganizing them to meet their expectations. Or if someone is got married and they got married to a healthcare worker who lives in the urban area and they would like to relocate to a rural area or urban area, there should be that consideration. That's what we are saying. But what we found now is that there isn't any willingness to bridge between the two, the expectation of healthcare workers and the policymakers. And we think that needs to be there needs to be that consideration, that merging. Without any additional financial resources, we think that distribution of the health workforce and availability will be improved by just considering these circumstances around healthcare workers.
Fantastic. Well, I really enjoyed reading your article, and congratulations again on it.
Thank you very
And
much, Melissa.
best wishes for the future. I hope this works out for Malawi and Tanzania.
Yeah, great. Thanks. I hope so too, and I hope the universal health coverage will be realized in these two countries.